Microscopically, the connective tissue elements of each components are clearly distinct. Tibial nerve is larger and lies anteromedially, whereas common peroneal nerve is smaller and lies posterolaterally. A clear septum lies between them. For this reason, to achieve the most effective block, the needle tip should ideally contact both the components of the sciatic nerve and elicit motor responses from both. So what is the ideal evoked motor response? Inversion of the foot is considered the most preferred response, followed by the plantar flexion, which is the next preferred response. But why inversion? Inversion is produced by the two muscles, tibialis anterior, which lies anterior to the medial malleolus and supplied by the deep peroneal nerve, and tibialis posterior, which lies posterior to the medial malleolus, supplied by the tibial nerve. Thus, inversion confirms stimulation of both tibial nerve and common peroneal nerve components. In contrast, eversion is the least preferred response. It is caused by peroneus longus and brevis muscle, both innervated by the common peroneal nerve. Hence, eversion suggests incomplete stimulation. However, in lateral approaches, the needle enters from the lateral side, so common peroneal nerve responses are more commonly elicited. In such cases, volume is increased from 20 ml to 30 ml to involve the larger tibial nerve component from the lateral side or compensate for limited reach. In proximal approaches such as parasacral, the sciatic nerve also gives off muscular branches to the hamstrings early. Therefore, hamstring contraction can be considered acceptable responses in this region. To summarize, inversion is the ideal response that indicates both components are being stimulated. Plantar flexion is acceptable, indicating stimulation of the larger tibial nerve component. Eversion or dorsiflexions are not preferred, indicating stimulation of the common peroneal nerve only, whereas hamstring twitches are acceptable only in parasacral sciatic approaches.